First Aid for Choking, a step-by-step guide that explains what to do in the event of a choking emergency. Choking occurs when a foreign object becomes lodged in the throat or windpipe, obstructing airflow. A piece of food is frequently the culprit in adults. Small objects are frequently swallowed by young children. Because choking prevents oxygen from reaching the brain, provide first aid as soon as possible. Hands clasped to the throat is the universal sign for choking. If the person does not give the signal, look for the following signs: inability to communicate, breathing difficulties or noisy breathing. When attempting to breathe, you may hear squeaky sounds. Cough, which can be either weak or strong, blue or dusky skin, lips, and nails. If your skin is flushed, the color then changes to pale or bluish. Consciousness loss, if the person is able to cough forcefully, he or she should do so. If the person is choking and unable to speak, cry, or laugh forcefully, the American Red Cross suggests a 5 and 5 approach to first aid, 5 blows to the back. Place yourself to the side and just behind a choking adult. Kneel down behind a child. To provide support, place one arm across the person's chest. Bend over at the waist so that the person's upper body is parallel to the ground. With the heel of your hand, deliver 5 separate back blows between the person's shoulder blades. Perform 5 abdominal thrusts. 5 abdominal thrusts, also known as the H, should be performed. Make 5 abdominal thrusts, also known as the Heimlich maneuver. Alternate between 5 blows and 5 thrusts until the obstruction is removed. The American Heart Association only teaches the abdominal thrust procedures, not the back blow technique. If you haven't learned how to use back blows, it's fine not to use them. Both approaches are valid. To perform the Heimlich maneuver, abdominal thrusts, on someone else, place yourself behind the person. To maintain balance, place one foot slightly in front of the other. Arms should be wrapped around the waist. Tip the person forward just a tad. Kneel down behind the child if he or she is choking. Make a fist with one of your hands. Place it just above the person's navel. With the other hand, grasp the fist. Press firmly into the abdomen with a quick upward thrust, as if attempting to lift the person up. Perform 6 to 10 abdominal thrusts until the blockage is removed. If you're the only person on the scene, perform back blows and abdominal thrusts before dialing 911 or your local emergency number for assistance. If another person is nearby, have them call for assistance while you perform first aid. Perform standard cardiopulmonary resuscitation, CPR, with chest compressions and rescue breaths if the person becomes unconscious. To perform abdominal thrusts, Heimlich maneuver, on yourself, do the following. First and foremost, if you are alone and choking, dial 911 or your local emergency number immediately. Although you won't be able to deliver effective back blows to yourself, you can still use abdominal thrusts to dislodge the item. Make a fist just above your navel. With the other hand, make a fist and bend over a hard surface, such as a countertop or a chair. Make an inward and upward fist. To clear a pregnant woman's or obese person's airway, position your hands at the base of the breastbone, just above the joining of the lowest ribs, slightly higher than with a standard Heimlich maneuver. Proceed in the same manner as with the Heimlich maneuver, pressing hard into the chest with a quick thrust. Repeat until the food or other obstruction is removed. If the individual falls unconscious, proceed with the following steps to clear an unconscious person's airway. Lower the person onto the floor on his or her back, arms to the side. Make sure the airway is clear. If a blockage is visible at the back of the throat or high in the throat, reach into the mouth and sweep out the source of the blockage with your finger. If you can't see the object, don't try a finger sweep. Take care not to push the food or object deeper into the airway, which is common in young children. If the object remains lodged and the person does not respond after you have taken the preceding measures, begin CPR. The object may be dislodged by the chest compressions used in CPR. Remember to recheck the mouth on a regular basis. To clear the airway of a choking infant under the age of 1, sit down and place the infant face down on your forearm, which should be resting on your thigh. With your hand, support the infant's head and neck, and position the head lower than the trunk. Use the heel of your hand to gently but firmly thud the infant on the middle of the back 5 times. The combination of gravity and back blows should be enough to dislodge the obstructing object. To avoid hitting the infant in the back of the head, keep your fingers pointed up. If the infant is still not breathing, turn the infant face up on your forearm, resting on your thigh with the head lower than the trunk. Give 5 quick chest compressions with 2 fingers placed in the center of the infant's breastbone. In between compressions, press down about 1.5 inches and allow the chest to rise again. If breathing does not resume, repeat the back blows and chest thrusts. Request emergency medical assistance. If one of these techniques opens the airway but the infant does not resume breathing, start infant CPR. If the child is over the age of 1 and conscious, use only abdominal thrusts. To avoid damaging ribs or internal organs, avoid using too much force. Learn the Heimlich maneuver and CPR in a certified first aid training course to prepare for these situations. Please remember to subscribe, like and share.